So, the heart. Well, I will distribute the hearts in a second. Just to give you an idea about the location, if you would look at the, well, with its secondary sexual characteristics, primary sexual characteristics completely removed, you can't really say if the body third from the right is that a male or female. All anatomical details have been carefully ripped away, but you can see the heart, okay, located in the mediastinum right here. So it's technically, when you do this, your hand is more over the lung rather than the heart. If you want to put it over your heart, do something like that, okay? So second and fifth rib approximately, basically. The level of several thoracic vertebrae, but around seventh thoracic vertebrae. It is on top of the diaphragm. You can see the superior surface of the diaphragm. So this is the diaphragm, that's where the heart is. And it is slightly to the left. 2/3 of it is left from the mediastinal line. You can see mediastinal line going approximately through this. It is anterior to the vertebral column, and it's protected up front, up here, by the sternum, which is not seen there, but you can appreciate the sternum protecting the heart. Okay. You can see the base and the apex, sort of counterintuitive. Base is on top of the heart and apex is on the bottom. We have some heart models. I'm tempted to say they are up to scale, but they aren't. So for instance model, the apex of the heart is going to be this. Tip, bottom. So around, sixth rib, we can feel the apical impulse under the left nipple. Pretty much hard bit. But specifically because apex is sort of closer to the superficial tissues. And sorry about that. Okay, we need one more, right? I gave you two. Well, they're not very much different, aren't they? So, if you would look at the picture of the heart right here in the left center part, so that this is essentially a base. This is the apex. Are we clear about it? Okay, so heart is in the pericardium. If I would remove that heart right there, this one, so basically this is pericardium. It's not a correct rendition, but you get a gist that this is the cavity, okay? That makes sense. Pericardium is covered by the membranes. The outermost layer that surrounds the pericardium, shown here, so-called pericardial cavity, fibrous pericardium. It's the outermost layer of the serous membrane that covers pericardial cavity. Does that make sense? The fibrous pericardium is tough, strong, pretty much kind of anchors the heart in place. Immediately next to it, immediately deep to it, right here, the thin layer of parietal pericardium. Remember, parietal layer is the layer of the serous membrane that lines the cavity. I don't have, no, it's 2. So basically, if that's the membrane, I will stick my finger inside, okay? Then my finger is covered by visceral, and whatever cavity is here, that layer is parietal. Does that make sense? And then visceral pericardium. You can see thin white layer over here. That's the visceral pericardium. Visceral means attached to the organ. Does that make sense? So if we go from superficial to deep, we go fibrous pericardium, parietal pericardium, and visceral pericardium. You can see that visceral and parietal are separated by the cavity. I'm going to strike through the cavity now. Okay. This cavity is called pericardial cavity. It is filled with fluid that lubricates heart, basically. Okay. Watery fluid prevents rubbing of the heart against the walls of the cavity. Now, pericardium can get inflamed. And it can get inflamed due to trauma, yes. Just chest trauma. Like being hit very, very hard, okay? But most frequently, pericardium gets inflamed due to the infection. Different viral or bacterial infections. From top of my head, I can't remember the primary cause, like the most common cause of bacterial pericarditis. For some reason, the name that pops up in my mind is tuberculosis. It definitely can cause. Whether it's the main issue, I don't really know, okay? But it can cause. Does that make sense? So here's what happens. When that serous membrane that surrounds pericardial cavity, parietal pericardium, and heart itself, visceral pericardium, gets inflamed, then two major outcomes are roughening of the surface of whether either parietal or visceral pericardium. So basically, two layers that previously were smooth now become roughened, and they start to rub against each other, and that is called pericardial friction rub. It can be heard with the stethoscope and is one of the diagnostic characteristics of pericarditis. Outcome number 2, which is more severe, I would say, is accumulation of fluid in the pericardial cavity, which is sometimes referred to as pericardial fusion or cardiac tamponade. Now, if you think about this, you have a cavity. Okay, and inside of that cavity is the heart, which is surrounded by the visceral pericardium, the blue line. When fluid gets accumulated in here, and I mean accumulated more than normal, then heart cannot dilate properly. The stroke volume decreases, the efficiency of pumping decreases, muscle has to work harder, basically. So pericarditis leads to the cardiac insufficiency. Does that make sense? Oh, we never mentioned the size. Human heart is about the size of a fist, maybe a little bit bigger. We may, don't take it as a promise, but we may have a chance to dissect the cow hearts. I need to check with one of my colleagues if he'll be willing to ask. Speaking of which, if anyone lives in more rural area and has an access to a proper butchery, okay, not like butcher shop, but like real butcher, ask. They may have a heart or two or more. And if they do, let me know. We can organize so they will get paid. College will pay and will dissect hearts. No, seriously, just pretty much all I need is the phone number. I try to get hearts from the butcher shop in Manor, but they butcher them, pun intended, so bad that they are of no use for the class. They basically like chopped. Okay, there are no large vessels. They in a pretty bad shape. Okay. Now, heart wall. Now we're talking about the heart itself. Heart wall has 3 layers. So we mentioned the outermost layer is visceral pericardium. Sometimes it is referred to as epicardial layer or epicardium. Do I make sense? Epi, above, on top. Then you have thick layer of muscle. Basically, in terms of cuisine, heart is a muscle which it's as lean meat as you can find anywhere. We're talking about healthy heart. We cooked it once. It tastes like rubber. I don't know, maybe we did something wrong, but it's chewy. It's like a gum. Okay? But it's lean meat because of that myocardial layer. Myocardium is functionally probably is one of the most important layers. When we talk about heart function, how it pumps, we talk about myocardium. It's basically muscles that are organized in the bundles. You can see the bundles here. And these bundles, they have a specific structure. The bundles, the muscle, cardiac muscle is partitioned by the connective tissue, which allows different parts of the heart contract at different moments and sort of different mechanics. If you think about it, I'm going to borrow this big heart, okay? Say right ventricle will contract and left ventricle will contract. They will contract at the same time, but they're completely separated. So ejection that they will produce, those ejections will go to different blood vessels. Does that make sense? Myocardium is the place where electrical signals go. So when we do electrocardiogram, we measure electrical activity of the heart muscle. Can be infected with a bunch of viruses and bacteria. The most common cause of infectious myocarditis is the Coxsackie virus. You know what Coxsackie is? Just the word Coxsackie. Just the word. You probably heard about the virus. You know, it causes, it's virus that's transmitted by fecal-oral route, causes myocarditis. Pretty severe. There's no treatment, no vaccine. It's actually a city in the state of New York where this virus was isolated. A bunch of bacteria can do that. Protozoa, say, trying to make it relevant, Trypanosoma cruzi, causative agent of Chagas disease. If you eventually will move to the south, like Texas, Arizona, New Mexico, especially in the southern parts of those states, you will find a lot of immigrants from Mexico and South American states. Those are the countries where Trypanosoma cruzi is very common. Although you will not see the transmission in those states, you may find patients who suffer from chronic infection with that protozoa that leads to very severe cardiac muscle pathology. Does that make sense? I cannot go by my favorite helminths, Trichinella spiralis. Again, if you decide to move up north to Alaska and pick up the local customs, such as hunting and then eating bears, beware that if you eat bear, You either have to cook it properly and then it tastes like a shoe sole, or you have to not cook it properly and then you're going to get trichinosis almost inevitably. And if you don't treat yourself, those little tiny cute wormies will end up in all your muscle tissue, including cardiac muscle. And you will eventually die of rhabdomyolysis or myocarditis if you don't treat it. Now, endocardium is the layer of simple squamous epithelium that covers heart from the inside. So basically, if we would pretend that that's an actual heart, that model, and we would open it, and we would look inside, then that inner surface of the heart would be covered with simple squamous epithelium. Essentially, that simple squamous epithelium, endocardium, is the continuation of simple squamous epithelium that covers the blood vessels. And probably the most common pathology associated with that simple squamous epithelium is the inflammation of the valves, because valves are covered by those cells as well. And one of the most dangerous complications of respiratory infections with such bacteria as Staphylococcus aureus, Staph aureus, or Strep pyogenes, that's the causative agent of strep throat. Probably the most notorious complication, singular, is so-called rheumatic fever. When patients develop infection of the heart valve with those bacteria, it leads to formation of so-called vegetations, like grape bunches of bacteria and white blood cells on the blood vessels, which prevents blood vessels from closing properly. And it again can lead to either valvular stenosis or regurgitation of blood through the valves, and basically, again, heart doesn't work as it should. Does that make sense? So understand 3 layers, be able to locate them on a picture. Infections, that's the matter of physiology part. Okay. Does that make sense? Now, chambers. I probably should get a heart for myself. Every heart, every mammalian heart has 4 chambers. I specifically say mammalian. How many chambers do amphibia have? How many chambers? Amphibia? 3. Amphibia have 3. Reptiles have kind of 4. And fish, as far as I remember, have 2. Okay. Okay, let me get rid of this card. Okay. Even better. So this is the heart with 4 chambers. That's the anterior wall of the heart. We'll probably need it later. Receiving chambers are atria. Okay. So this is one receiving chamber. I stick my hand into it. And kind of, let's see if, okay, so that's going to be, right here is going to be the second receiving chamber. It's left atrium. Okay, right and left. We're clear. In this image, you can see right atrium and left atrium. Okay, atria are separated by the interatrial septum. It's not really clear in the picture. Good? Septum, generally, the term septum means the wall. Okay. Here you can see the depression in the interatrial septum. It's called fossa ovalis. It's the remnant of foramen ovale. In babies, chambers in the heart, not in babies, but in fetuses. They're not separated because they don't need the separation of the circuits. Why? They don't breathe, so they don't need the separate circuit going to the lungs. Does that make sense? When they born, basically, before they born, fossa, the foramen ovale closes, and all is left is that little depression called fossa ovalis. In some babies, it's not closed. Those babies are in deep trouble. In those babies, there are many fascinating congenital heart defects. This is one of them, and it can be surgically fixed. Okay. Usually the milder heart defects, congenital heart defects, manifest as the cardiac insufficiency and therefore respiratory insufficiency, a lack of proper oxygen transport to tissues. There are some really, really bad, severe congenital heart defects. Some of them basically are not compatible with life unless they are properly fixed, sometimes in utero. Okay. On top of the atria are auricles. You see those floppy structures? You kind of can appreciate them here. So that's a floppy structure, and that's a floppy structure. Auricle means ear, so it's like ear-like structures. They increase the size of the atrium. Not much, but they do to accommodate more blood. Okay. In the right atrium and in the left auricle, you can see the pectinate muscles. Pretty much a distinctive anatomical feature. But what I really want to focus your attention to are the big vessels that come to atria and to ventricles. Let's start with atria. So this, it gets spontaneously disassembled. Okay, so I hope it will not now. So this part on the right is the right atrium. So as I mentioned, atrium is a receiving chamber. So right atrium receives what? Which fluid? Urine? No, what? Blood. Okay. So 3 collecting vessels. Superior vena cava, inferior vena cava, and let me see if I can... Well, you will have to trust me on that. If you would look into the right atrium of your models, I don't know about those models, they may actually have better picture. The third blood vessel that empties into the right ventricle is so-called posterior or coronary sinus. Let me see if your model provides us with posterior sinus. Yeah, oh, awesome. Here. That's the posterior sinus. Okay? It empties into the right ventricle too. Does that make sense? Now, anatomically, superior vena cava brings the blood from which part of the body? It's a very simple question. Superior vena cava brings the blood in from the top, stuff that's above the heart, basically. Inferior vena cava brings the blood from bottom part of the body. And coronary sinus, this vein, collects the blood from the heart itself. Does that make sense? So, right atrium receives the blood from all the organs. Tissues, I would say. Tissues, not just organs, tissues. Like connective tissues in the lungs, brain, muscles, kidneys, liver, whatever. Okay, all of it goes into the right atrium. So what goes into the left atrium then? If you would look, left atrium collects the blood via these blood vessels, this and these two blood vessels. And left atrium, shown here, collects the blood via pulmonary veins. Left pulmonary veins and right pulmonary veins. You look at the picture right there. Pulmonary veins, what color do they have? Huh? Red. When we talk about like anatomy drawing, what does red, when it's applied to the blood vessels, mean? Oxygenated. So pulmonary veins bring oxygenated blood to the left atrium. From where? From lungs. I wanted to ask you a question, totally forgot what the question was. Oh, based on the information that I just provided to you. So superior vena cava brings the blood from the upper body to the right atrium. Pulmonary veins bring the blood from the lungs to the left atrium. Can you give me a short and very succinct definition of a vein? It takes blood to the heart, period. No exceptions. That's the definition of a vein. Does this definition say anything about oxygenation? It says nothing about oxygenation, and that's very important. In general, we presume that veins carry non-oxygenated blood, but it's not entirely true, right? Pulmonary veins right here, they carry oxygenated blood. The point is, to the heart. Are we clear? Ventricles. 2. Right. This one. And left. Okay. So right ventricle is mostly on the anterior portion of the heart. Left ventricle, so that's right ventricle. Left ventricle will be lateral and posterior. Separated by the septum. You can see septum here on the model. And here on the picture. This is a coronary sulcus. Going here. Let me remove all that crap from. So this is the sulcus. It's a coronary sulcus. Separates atria and ventricles. A little depression. That's where the coronary arteries are sitting. And there's anterior interventricular sulcus. That's the sulcus between the ventricles. So anterior interventricular artery. Okay? Now if you would look inside, you will see ridges, muscle ridges. Trabeculae carnae. See the ridges? Remember we talked rugae? Now this is not rugae, this is ridges. So trabeculae carnae they control the motion of the structures called chordae tendineae. You see the white tendons? Okay. These tendons are extremely resilient. They open and close cardiac valves that separate atria and ventricles. Does that make sense? So here you can see that right atria and right ventricle are separated by so-called tricuspid valve. A valve that has 3 cusps. Something like that. So 3 cusps. Left atrium and left ventricle are separated by the mitral valve, which will look like this. Sometimes, so tricuspid, it's bicuspid, or mitral. Okay? Does that make sense? Now, when ventricles contract, they eject blood. Right ventricle ejects blood in here, in so-called pulmonary trunk. Okay? What color is pulmonary trunk? Blue. So what kind of blood goes there? Deoxygenated. But is that an artery or a vein? It's an artery because it goes away from the heart. And where does it go? To the lungs, pulmonary trunk. Does that make sense? Awesome. So pulmonary valve right here. Pulmonary valve separates the right ventricle and pulmonary trunk. It's called semilunar. Forms, it is like this. Okay? So when blood pushes from the bottom, it opens. And then when there's no push, it closes back. That makes sense. And left ventricle and aorta are separated by the barely visible aortic valve. Does that make sense? So aortic valve is also semilunar, and it also opens in response to the push from the blood. Now, I will post, we're going to wrap up by now, and we're going to chat about valves and pathologies of the valves on Wednesday, and we're going to go over the blood vessels. But so far, I'm going to post the list of terms. It's very straightforward. Complete list, what you need to know. There's a lot, but I will not ask anything but what is there. Am I clear? Good.